The UK government has destroyed over 50 million doses of the COVID-19 vaccine. A Freedom of Information request to the UK Health and Security Agency has confirmed that the UK government purchased 397 million doses of the COVID-19 vaccine. This is enough vaccines to give 50 million UK adults 8 doses each. The cost to the taxpayer for those near 400 million doses was £6.5 billion. To date, 367 of the 397 million doses have been delivered to the government. The NHS confirms that 165 million of the 367 million doses have been administered. What happened to the other 200 million doses? Part 4 of the Freedom of Information response confirms that, as of May 2024, over 50 million doses of the COVID-19 vaccine have been destroyed, most of which due to passing their expiry date. The cost to the taxpayer of those 50 million destroyed doses is around £1 billion. The UK government also confirms that it gave away 80 million doses of COVID-19 vaccines to other nations. This is at a cost of around £1.5 billion to the taxpayer. The UK government directly gifted 9 million doses to developing nations. 71 million doses were donated to COVAX, who determined the destination of the vaccines, but again, these were mostly distributed to developing nations. COVAX was a multilateral agency set up by Gavi, the World Health Organization and UNICEF in 2020 to ensure fair and equitable access for every country in the world to the COVID-19 vaccines. The UK government confirms that it took delivery of 20 million doses of the Janssen COVID-19 vaccine, otherwise known as the Johnson & Johnson vaccine. Not a single dose of the Janssen vaccine was given in the UK. All 20 million doses were donated to COVAX. The UK government also purchased 100 million doses of the Oxford AstraZeneca vaccine. Around 50 million doses of the Oxford AstraZeneca vaccine were given in the UK during the rollout of Dose 1 and Dose 2. The other 50 million doses were either destroyed or donated. In April 2021, just 3 months after its authorisation by MHRA, the AstraZeneca vaccines were suspended for use in the under 40s due to the possible link between the JAGs and an extremely rare blood clotting condition known as thrombosis thrombocytopenia syndrome, or TTS. The AstraZeneca COVID-19 vaccine would not be used as a booster dose in the UK and was effectively pulled from use by August 2021, as confirmed in this distribution graphic from the MHRA. The UK government and health authorities are currently in the middle of promoting the 2024 Spring-Summer COVID-19 booster programme. For UK citizens over 75 or those with underlying health conditions, this will be the 8th dose of COVID-19 vaccine that they have been offered or received. When the UK government ordered 400 million vaccine doses for a total population of 65 million, adult population of 50 million, it was clear from the offset that their plan was not just to offer a simple 2-dose course of the vaccines, as it was originally claimed. A copy of the Freedom of Information request discussed in this video is provided within the description, along with links to the data provided by official government agencies, the NHS, Medicines and Healthcare Products Regulatory Agency, the MHRA, and of course the UK Health Security Agency. Thanks for watching, and please share this video.